Oral questions by members.
Leader of the Official Opposition.
Thank you, Honourable Speaker. In July, British Columbia saw the second highest number of overdose deaths ever recorded, 184 deaths, almost 6 people every day. We are on track for the worst year on record. When he was in opposition, the Premier had a lot to say about this issue. He had lots of answers. Well, here's what BC Coroner Lisa Lapointe said about the response from this Premier and his government, and I quote, "It makes me sad. It honestly makes me very, very sad. What we have seen is small steps, primarily left to one ministry, and that is not enough. It needs a really meaningful response that will actually affect change," end quote. So to the Premier, how many months will have to go by with ongoing record numbers of death in British Columbia before this Premier admits that the approach he has taken for 4.5 years is not working?
Premier.
Thank you, Honourable Speaker. Thank you, Honourable Speaker, and I thank the member for her question. And clearly, all members are aware of the absolutely tragic outcomes we're seeing across not just British Columbia, but indeed across Canada, as an increasingly toxic drug supply has profound impacts on individuals, families, and communities. And we have redoubled our efforts since last October by making repeated overtures to the federal government to ensure that we can start by decriminalizing simple possession of opioids. We have run into resistance on that front, but I'm confident the work of the Minister of Mental Health and Addictions and the work of the incoming federal government will bear fruit in that regard. At the time of our swearing in, the then Solicitor General, the current Solicitor General, made it clear to law enforcement that we were not interested in prosecuting people. We were more interested in finding health care. And that's why we've increased the number of wellness beds at Royal Columbian Hospital. We've increased the number of youth treatment beds in Chilliwack, and the list goes on. The establishment of foundries, which were begun as an idea and a concept by the former government. All of us working together is the way we come out of this, Honourable Speaker. I share the disappointment and profound unhappiness for the results that we've seen over the past 2 years. But I think that the context is important, and I know the minister didn't want, the member didn't want to leave anyone with the perception that we didn't have other things going on. A parallel health crisis with respect to COVID-19 has meant that we've had to amend and deal with addictions differently, deal with housing differently than we have in the past, and that has produced tragic consequences. But we take full responsibility for where we are, and we take absolute responsibility for how we're going to go forward.
Leader of the Official Opposition, supplemental.
Well, thank you very much. And if the Premier is prepared to take responsibility, he needs to stand up and say and tell British Columbians and confirm the fact that things are getting worse, not better. Let's look at the numbers. 6,120 people have died of an overdose since the Ministry of Mental Health and Addictions was created in June of 2017. According to the coroner, again, and I quote, "What we have seen are small steps, not always in the same direction, and really not addressing the bigger issues. The fact that we haven't seen a coordinated response to reduce these numbers of deaths is just sad. It's heartbreaking," end quote. The Premier stood up and he told British Columbia that the reason he was creating a Ministry of Health and Addictions was to make sure that there was a coordinated response. It is getting worse, it is not getting better, and the Premier's answer just isn't good enough. So to the Premier, will he stand in the House today and finally admit that after 4.5 years, the approach isn't working, he needs to fix the ministry that he created to make sure that we don't stand in this House month after month after month talking about record numbers of lives lost in our province?
Premier.
Well, thank you, Honourable Speaker. We were making progress up until 2019 and the advent of COVID-19. The evidence is demonstrable. The member should know that. We'll certainly pass that data over to her so she can review it. In the past budget, an historic $500 million commitment to mental health and addictions. There was no Minister of Mental Health and Addictions 4 years ago, Honourable Speaker, because those on that side of the House didn't put the same level of interest in it then as they do today. And that's unfortunate, Honourable Speaker. It's unfortunate, Honourable Speaker, but we've also taken other additional steps in communities by making sure that urgent primary care centres have access to social workers and other health care providers so that they can directly intervene when opportunities present themselves. Safe injection sites and other harm reduction policies are the foundation of success. And it will take time, it will take patience, and it will take collective action by all of us. I appreciate that it's question period, and I appreciate that the members on the other side came here to shake their heads in disappointment. We on this side of the House are working every single day to improve the lives of British Columbians, and we're not going to stop because you're unhappy.
Member for
The Premier.
Member for Surrey White Rock.
Well, to correct the Premier, it's just not working. And what is clear is that the minister and the ministry responsible are failing British Columbians, and we are seeing that month after month. 6 people a day. We are losing 6 people a day. And this minister says, and I quote, "This year continues to be incredibly sad," end quote. We can't just be sad. We need this Premier to do something, and he needs to do it now. Since this ministry was created, the per capita death rate has doubled. My question to the Premier is this. His approach with this ministry and this minister has failed. Will he put someone in charge who can take the appropriate action?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. That despite an unprecedented new wave of measures year after year, that despite an unprecedented spending, despite unprecedented effort on the part of our healthcare workers and frontline providers, that we continue to lose lives at such a tragic rate is a tragedy. It is a phenomenon that is being experienced across North America. It has been directly correlated that as soon as the pandemic hit, drug toxicity spiked. The coroner has continued to document the increased toxicity that is falling people, despite the fact that we have doubled the number of supervised consumption sites, despite all of the measures that we brought in. And I have another quote from the coroner from February when she had yet another terrible report about the loss of life in the province. She said, quote, "The fact that there is a Ministry of Mental Health and Addiction whose focus is on supporting people to wellness is a huge step. As I say, it is a big ship to turn around. We are shifting from punishment and criminalization to supporting and providing medical treatments to people who are struggling with addiction," end quote.
Member for Surrey White Rock, supplemental.
Thank you, Mr. Speaker. And what we are seeing from this ministry and this minister and this Premier is an unprecedented failure. The words that the minister is speaking offer no comfort as the numbers climb and as people continue to lose loved ones across this province. The minister just cited a quote from the coroner, and I will give another one from the coroner. And I quote, "For the coroner and the paramedics, we know that 1,000 people who have died looks like, and it's just astounding. The fact that we haven't seen a coordinated response is heartbreaking," end quote. We know the ministry has no actual authority. Its budget is smaller than the office of the premiers, and now, sadly, it is now being called the Ministry of Air. So my question is to the Premier. Will he admit that it's time for a new minister and it's time for a ministry that can solve these issues and save British Columbians?
Minister.
Thank you, Mr. Speaker. So here's what the province has been doing with the coordinated response that our ministry provides, fanning out services through health, through education, through social development and poverty reduction, through Ministry of Children and Families. No one ever suggested that we were going to build an additional bureaucracy, but that we were going to bring addictions and mental health care in parallel with our physical health care system. There was never any intention otherwise. The Premier's instruction to my predecessor and friend Judy Darcy and to me is we want you to be single-minded in your cross-government focus. It is the Overdose Emergency Response Center that has housed within our ministry that coordinates overdose response strategy. It is Pathway to Hope that was designed with the input from people with lived and living experience with families across British Columbia. That is our roadmap, and we are working hard on it every day. I anticipate that the member's going to have more questions on this, fair enough, and I'll be able to elaborate in more detail each element of the plan and the increased number of both practitioners and people seeking help that are coming forward. And we will work hard every day to continue to try to end the public health emergency and work hard every day on that.
Leader of the third party.
Thank you, Honourable Speaker. It's been fascinating to hear 4 questions from the official opposition and 4 responses from the government on this issue. In the last 100 days since we haven't been sitting, 600 people have died. We know what they have died from. They have died from a poisonous drug supply. And yet, in the 4 questions we've heard and the 4 responses we've heard about overtures to the federal government for decriminalization, social workers, safe injection sites, other harm reduction methods, new waves of measures. It's a tragedy. But nobody has spoken about a regulated safe supply, which is what experts, doctors, healthcare workers, and advocates have made clear, that if we want people to stop dying in this province at the rate of 6 people per day, then the poisonous illicit drug supply needs to be replaced with a regulated safe supply. My question for you, Honourable Speaker, is to the Minister of Mental Health and Addictions. Will we see steps taken to ensure that it is not a poisonous drug supply that is killing British Columbians every day?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. My previous minister, my friend and predecessor, Judy Darcy, the Minister of Health and the Public Health Officer were already working on safe supply as a way to separate people from the toxic drug supply, because what we're hearing from people on the ground and from families is that it was toxic drug supply that was killing people. When the pandemic hit, within 2 weeks, we were able to implement quickly through public health orders and through cooperation across all of government, prescribed safer supply. The uptake in that in the month since, year and a half since, has been a 425% increase in the number of people that are receiving prescribed safe supply. In July, I stood with Dr. Bonnie Henry and we announced an expansion of that prescribed safe supply. Nobody else in Canada is doing this. That people now can be prescribed a fentanyl patch for the purpose of avoiding an overdose is unprecedented. We're grateful to the frontline nurse practitioners and addictions medicine doctors that helped us design the system. Those brave frontline people, particularly in the downtown east side, who have piloted this work. And we are continuing to expand it every week with every health authority across the province. We're determined to do more, and there's more to do.
Leader of the third party, supplemental.
Thank you, Honourable Speaker, and I appreciate the Minister's response. I think it's important to note that prescribed safe supply presents an extraordinary barrier for people, particularly those who have had less than ideal interactions with the healthcare system. And when we consider, for example, the indications and evidence of systemic racism for Indigenous people in the healthcare system and the number of Indigenous people dying from a toxic drug supply, we need to be able to go beyond what is existing right now. In July, Crosstown Clinic in Vancouver started providing safe medical-grade heroin for patients to take home. It was the first of its kind on this continent. And the dozen or so initial patients said it was humanizing. It was humanizing not to have to line up daily for their doses. It lets people take on jobs, spend time with loved ones, and take care of their families. But just last week, this program was quietly canceled. No word from the Minister of Health, the Minister of Mental Health and Addictions, or Vancouver Health has been received. When we compare ourselves to the lowest denominator, we are the most progressive in North America, and yet we have the third highest death rate from the toxic drug supply in North America. This government needs greater ambition if we are to truly save people from this toxic supply, and that starts with transparency on progress and a commitment to maintaining programs that remove the influence of illicit drugs. My question, Honourable Speaker, through you, is to the Minister of Mental Health and Addictions. Why was the regulated heroin program cancelled only months after it started, and what is the Minister doing to not only get it back up and running, but to expand it?
Minister.
Thank you, Mr. Speaker. The work of Crosstown Clinic and multiple other service providers in Vancouver and across British Columbia is saving lives, breaking new ground, working within the framework that the federal legislation requires. We are learning lots from them, and we are removing barriers wherever we can. The Crosstown Clinic home carry program that the member references has not been cancelled, but the 11 people that are receiving that groundbreaking service delivery as another way to separate them from the toxic drug supply have encountered a barrier through the College of Pharmacists that we are working hard right now to resolve. I spoke just this morning with Dr. Scott McDonald, the lead on this. The program is not cancelled. Those people are still receiving the treatment that they need, the medication that they need. But the home carry piece, which had been working well, is now through the college is a conversation that we are having. And I'd be very happy to update the member on what I learn in coming days. We're working hard to resolve it.
Member for West Vancouver Capilano.
Thank you, Mr. Speaker. 2 weeks ago, a so-called progress report on mental health and addictions was released, which included a disappointing update on the youth treatment beds promised by this government in August of 2020. This is what government's own report says on page 11, and I quote, 30 beds are currently in the process of implementation, with the remaining 93 beds in planning, end quote. That's right. After 14 months in the middle of a crisis, implementation hasn't even started on more than 3/4 of the promised beds. So my question to the Premier, why has this minister failed to actually implement what was promised 14 months ago?
Minister of Mental Health and Addictions.
Thank you very much, Mr. Speaker. The commitment to double youth treatment beds, which is an unprecedented expansion in British Columbia and long overdue, had a promised delivery date of 2023. We are well on track to meet that. In the meantime, earlier this year, we added 100 95 adult treatment beds. We have a commitment to implement another 195. A year ago, we opened a new, really innovative youth treatment center, 20 beds in Chilliwack. It's named Traverse. I just visited it last week along with the member for Chilliwack. And there are more and more addiction treatment, bed-based detox recovery programs and supports that we've added for youth across British Columbia. The Interior Health was able to move more quickly than some of the other health authorities during the pandemic to stand up and let the contracts for those youth treatment beds, but they'll all be in place by 2023 as promised.
Member for West Vancouver Capilano, supplemental.
Thank you, Mr. Speaker. In June 2019, this NDP government claimed they would, quote, help people immediately by opening more Foundry centres. Yet 28 months later, this is what the report says, and I quote, the additional 8 Foundry centres are in development, end quote. Promised beds are missing, and there have been no new Foundry centres actually opened over the 2 years since they've been promised, so the minister is failing to deliver. Can the Premier offer details, not just words, on when exactly British Columbians will receive beds and Foundry centres that were promised years ago?
Minister.
Thank you, Mr. Speaker. Foundries do not have any bed-based component, but they do offer fantastic connection to addiction and treatment recovery services, to reproductive health, to primary health, and mental health counseling. As the member can appreciate, during the time of the pandemic, most Foundry centres were not able to open at all. We instead moved the platform online and developed with youth, something designed by youth also, a Foundry app, so that now people in every community across British Columbia are able to connect, and the data that comes from the Foundry leads is quite encouraging around new people that maybe were not willing to walk into a centre that are willing to engage online. We are still on track to open it it'll be a total of 23 Foundry centres, and some of them will be opening in some of the opposition members' communities very soon.
Member for Kamloops South Thompson.
Thank you, Mr. Speaker. Well, communities are pleading for more crisis intervention units with police and trained mental health workers. But requests to expand units like CAR 40 in Kamloops and proposals for new units in other communities have consistently been rejected by health authorities and by this government. The mayor of Coquitlam has written about his personal experience, saying, and I quote, "For several years now, Coquitlam has pressed for a mental health CAR program similar to Surrey's CAR 67. Unfortunately, Fraser Health has so far refused and has just rejected a similar request from Burnaby," end quote. So the question to the Premier is this: why are communities across the province being left to deal with this crisis alone?
Minister.
Thank you, Mr. Speaker. The manner of deciding where the implementation of mental health support dollars will go is done always with the people that are most connected on the ground, and that is health authorities across British Columbia. There are extremely successful CAR programs across British Columbia where psychiatric or mental health care workers, psychiatric nurses or mental health care workers will be paired with police. We have a lot of successes to point to. Also a number of areas where the health authorities say that actually direct funding to an on-call nurse or a home support nurse to deliver mental health services would have worked better. So we continue to be open to the proposals that the health authorities bring to us. We continue to be informed by the work that's happening through the Police Act review around how we can better direct, and the Premier has asked me to work on this specifically, better stand up community mental health and addiction supports so that we can allow police to focus on true crime and what they were trained to do. And we will continue to work with health authorities and with police, learning from the results of the Police Act review around how we can best resource this. In the meantime, communities should continue to speak with their health authority because they're the lead decision.
Member for Kamloops South Thompson, supplemental.
Well, thank you very much, Mr. Speaker. Well, the government's efforts are not working. The calls to police, the calls that police are being asked to respond to relating to the Mental Health Act are increasing dramatically. In Kamloops alone, over 100 police calls every month relating to the Mental Health Act are happening. And the CAR 40 program in Kamloops can only respond to about a quarter, or 25% of those calls. Why? Because the existing service is only funded by this government to the tune of 4 days a week until about 4:30, so regular business hours. Now, newsflash for the Premier, that mental health interventions actually also happen in the evenings, and they happen on weekends. This service has proven to be effective, and it needs a modest increase in funding to add an additional mental health nurse so that those British Columbians in our community who need the help will get the help. Now, the mayor of Kamloops says that the hesitation from this government is frustrating. And I quote, "We're providing most of the cards at the table here because we've got the police officers, we've got the equipment, we're providing the car, We're prepared to make that investment. I'm really getting a little frustrated that the government's smaller portion of that is holding up the implementation. End quote. And Mr. Speaker, in Fraser Health, it's the exact same situation. There's no plan to increase CAR 67, as it's called there. The Premier keeps saying that they're trying. Well, Mr. Speaker, they're not. Whether it's beds or supports or counseling or mental health intervention, this government is failing. So my question again to the Premier is this. Will the Premier commit today to expanding programs like CAR 40, like CAR 67, in the communities that desperately need those services?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. So the focus that we are bringing to support people that are in active psychosis, people who are in untreated addiction, particularly where we are seeing impacts on street disorder, on impacts on businesses and neighbors of people that have been living outside. All of that is built into the homelessness strategy and the work that I've been asked to do on complex care housing, finding a new way to connect people who have not been able to do well in supportive housing, to connect them better with the kind of treatment and housing that can allow them to be successful tenant and stabilize. And all of this is bolstered by our continued investment in ACT teams, on community action teams, all the ways that we can try to get at the kind of disorder and untreated mental health and addictions impacts that lead police to be called. That is happening in one branch of work. The other is the work with the Police Act review, where we continue to be informed by the evidence, working with the health authorities and working with police around where they need a direct pairing of mental health and policing, and we are committed to doing that work. That work study is underway, and we look forward to receiving the recommendations of the committee.
Member for Abbotsford West.
Thanks, Mr. Speaker. I'm afraid the answers and the excuses that we're hearing today will be of little comfort to grieving parents across the province. The grieving parents that wrote to me on Friday. Here's what they said. Our 17-year-old son was found yesterday morning in Vancouver, far from his Abbotsford home. He left his treatment facility after just a few weeks, and because of the laws in BC, we couldn't keep him there. Now he's dead. The system in place for children suffering from drug addiction is failing our youth. Tell your colleagues, they wrote to me, tell anyone who has the ability to make a difference that the way we are dealing with at-risk youth is most definitely not working. And we find out last month that some time ago, the government decided to cut funding for naloxone kits for emergency responders. And the Premier explained that by saying there was a supply issue, only to be contradicted a few days later by the Centre for Disease Control, who said there was no question about problems with supply. How do we take the words and the answers of the Minister and the Premier seriously when at the very time they're needed most, the government decides to cut funding for naloxone kits, life-saving naloxone kits, to first responders?
Government House Leader.
Thank you, Honourable Speaker, and I appreciate the question from the member opposite. And I want to assure the member opposite that there is no shortage of naloxone kits that are.
Let's listen to the answer, please.
They were out in Oak Bay, man. They were out in Oak Bay.
Minister.
Thank you, Honourable Speaker, because the questions have been asked and have been listened to respectfully and not been heckled. And the member asked a question, and I'm providing him with the answer, which is there is no shortage of naloxone kits. The issue that was raised was with one particular police department in Oak Bay that used a total of 2 naloxone kits this year. We've made it clear that naloxone is available to police departments right across this province. We work with police departments to ensure that they have a steady supply. The government's committed to doing that, and that is what is taking place. And there is no shortage of naloxone, and if police departments need it, it is there for them.
There you are.
Member for Abbotsford West on supplemental. Member?
Thanks, Mr. Speaker. Well, the Minister of Public Safety says supply wasn't a problem. The Minister of Mental Health, I think, chimed in at one point to say supply wasn't a problem. I guess the only person who seemed to be arguing that supply was a problem was the Premier. But Mr. Speaker, here's what the Victoria Police Chief said about a decision that was communicated to him and to police forces. He said, quote, "I'll be honest, when we all received a letter from police services that funding was going to be eliminated for naloxone training and naloxone kits, it was a bit of a head scratcher. We're all wondering why this would happen when we're in the midst of a provincial health emergency." For the police chief, for the first responders, and for those parents like the ones that wrote to me on Friday, decisions that lead to letters indicating funding for life-saving naloxone kits are more than just a head scratcher. They're tragic examples of faulty judgment. When is this government going to move forward with a strategy and an approach that has a positive impact? When are they going to take steps that make it better and not worse, so the kinds of letters I got on Friday aren't being sent with the frequency they are now?
Solicitor General.
Thank you, Honourable Speaker. And I think what we've seen is the Minister of Mental Health and Addictions has outlined exactly the work that is undertaking place on a cross-ministry basis right across this government. And in all ministries, as part of their mandate letter associated with this issue, are working in a coordinated fashion to ensure that we're doing everything we can. What the member has asked in terms of naloxone, again, I will repeat, there is one, no shortage of naloxone. Two, it came about as a result of one police department. It has been in place for 18 months that there is enough naloxone there, police departments need it, they get it, and training and all of those things are there in place to deliver naloxone when and where it's needed.
That ends the question period.